I'm in Washington, and Washington we really don't get started till 11 o'clock. People don't know that. They think the government's working all the time, but the reality is we don't start our day till 11 o'clock. Let me say, first of all, it's great to be out here in Silver Spring. This is my second time being in this building, and it's really wonderful. You guys got this kind of asset downtown that you can access. I mean, really a wonderful facility to hold such meetings, so it's always good to be out here. I want to first thank Stella Pacha, who I met last year up at Harvard at the Global Cancer Catalyst Summit. And I've had a chance to interact with her several times this year since then, and she's really dynamic. I mean, really absolutely dynamic. And what I like about her more than anything else, she's a really nice person, Usually when you got a dynamic person, they're mean and angry and yelling and screaming. She's real pleasant, real calm, but she gets stuff done. So Stella, thank you very much for inviting me. I also want to acknowledge Harriet Shankarai, who is really the chairperson for CFA's African Healthcare Infrastructure Committee. And she's also a very nice person. And what I like about Harriet, you guys got some nice people out here in the county. I'm in Washington. We hate each other, We yelling and screaming and caring. That's how we get stuff done. But Harriet is also a person who has quiet strength, You don't know it just hearing what she says or walking down the street. But then when you get to know her, you realize that she is actually a powerhouse. And very effective in getting things done, very effective in moving people. I think she's the perfect person to be chairing the Montgomery County African Affairs Committee. You're fortunate to have somebody of her talent, her grace, and her commitment to these issues. I'm honored to be here, first of all, in Minority Health. And when they told me this is Minority Health Month, I think every month should be Minority Health Month. What does this mean? This month is Black People Month, and next month is White People Month, or the other 11 months. Every month should be our month. And one of the things I do in the morning before I can use it this time, I'm out doing my miles. I do 3 miles a day, And I do it for, the health benefit, but also I use it to strategize, It's my thinking time. I brainstorm with myself. So I'm always thinking, so right now I feel a little bit heebie-jeebie. I'm going to go after I finish this meeting, and I'm going to go and do my miles, before I do anything else. That's my strategy for today. But I think every month is a Minority Health Month, and we ought to stop calling ourselves minority, period. We are humans, this is Human Month, and every human should have time to focus on their health care. Constituency for Africa. We're 27 years old as an organization, and our mission is to educate Americans about Africa, improve cooperation and coordination among people who work on African issues, and then we work to shape U.S. policies toward Africa. We work to shape the policy. We work to determine what our government, what the administration, what the president is going to do about Africa, And I'm going to have a little bit more to say about that because we have a new president here, and we need to say some things about the new president. I also, since the focus is on healthcare, we've done a lot on healthcare. My former chair was Congressman Ron Dellums, and we took on HIV/AIDS at the time, and we tried to engender a global response to HIV/AIDS. We came up with an AIDS Marshall Plan, and lo and behold, George W. Bush stood up at the mic during the State of the Union and said $15 billion for HIV/AIDS in Africa. And we were shocked. We were trying to push him to do something, but we were thinking 2 or 3 billion would be good, and he said 15 billion. And so, we've been, we're very pleased. That turned me around with George W. Bush. After all that elections in Florida and all that kind of thing, when he said Colin Powell, Secretary of State, Condoleezza Rice, National Security Advisor, 15 billion for HIV/AIDS in Africa, that changed my whole perspective. I became a George W. Bush supporter. We also got involved in the Ebola crisis. And, 10,000 people in Sierra Leone, Guinea, and Liberia lost their life during that crisis, 2013, 2014. And at that time, Americans really wasn't concerned about it until an American doctor, a white doctor, got infected. When the white doctor and a couple of nurses got infected, call the Army, call the Navy, we got to do something to stop this Ebola. because what we found out is that the world has gotten smaller, you know, and you can be infected with some disease, say in Sierra Leone, and not know it for 8 hours, and next thing you know, you're in New York City with that disease, you know. And is it a security matter for us? Heck yes. And so we've been able to connect, you know, health to security, you know. And once you made that understanding, it's an American national security interest, all of a sudden Americans are interested in it, you know. Let me say something about cancer, since that's the primary thrust of this conference. I didn't know much about cancer last year, and Harriet roped me into going up to Harvard for this summit, you know. Yeah, Harriet, why do you want me to go up to Harvard, you know? You know, Harvard, all they're doing is talking, all this talking, and everybody got a PowerPoint. And so she got me to, she's very persuasive. You know, she ought to be a politician. You know, county exec. I heard Ike Leggett is not running anymore. Maybe you ought to put your hat in the ring. I'll vote for you. But Harriet got me to go up to Harvard. And it was up at Harvard where I met Stella and a lot of other folks who advocate on cancer, this cancer issue. And so the first day I was watching all the PowerPoints, and all the people had all these designs. And, you know, you got really smart people up at Harvard. Everybody up there is smart. You know, everybody got a PhD. I was the dumbest one in the room. Didn't have no PhD, didn't have no MD. I felt insufficient up there. So the second day when it came time for me to speak, I thought about this, I watched everything. And what I realized was that everybody in the room was an expert on cancer in Africa, except me. And so they were crying. A lot of them had been affected by cancer. They had a relative, a loved one who was diagnosed or infected. They had a worker. You know, everybody knew somebody who had been affected by cancer. And I thought about it because in Africa, you know, we deal with a lot of health issues, mainly waterborne diseases, of course, HIV/AIDS, nutrition issues, sanitation issues. But didn't think much about cancer. You know, I didn't think cancer was an issue until I watched all these presentations. And they were talking about the numbers are going like this in Africa. And so I got up to do my presentation, and you know, the guy said, "Where's your PowerPoint?" I said, "I don't have a PowerPoint." You know. And but I did take note of the fact that while everybody in the room was an expert on cancer, nobody outside the room, including myself, knew anything about it. And if I don't know about it, that means the U.S. Congress don't know about it. That means the administration don't know about it. That means the African leadership don't know about it. You know, because that's where I work around those realms. I work around the policymakers. And if I don't know about it, they don't know about it. So my conclusion was that everybody in the room was just talking to themselves. There was a lot of crying. Everybody was emotional. You know, my message was don't agonize, organize. You know. If you want to do something about cancer, influence Congress, influence the administration, influence African leadership. You know, there's a lot of problems in the world, and what I found is if you don't do something about it, if you don't organize yourself and put pressure, political and otherwise, nothing's gonna happen. So it's about making the member of Congress understand if you don't do something about this issue, we're gonna make sure you don't get reelected. Then you got his attention. You know, if it's a matter of re-election, you know, when people run for Congress and they get elected, the first order of business is to get re-elected, you know? Before you even do anything, you try to put your re-election campaign together because you want to stay in those seats. And so as a public policy matter, you have to interject with that. So it was, you know, the conference was great. But I just felt it was a conference of people who all thought, you know, everybody knew each other, everybody was crying, and this was a conference of the crying. I thought it was a crying conference. So Will Ingwa, who was the coordinator, came to me afterwards and said, "Mel, I want you to help us to organize this next year. Your points were well taken." So I was asked to, I was really retained as a consultant this year to help them to restructure and to reboot it up. And so the conference is next week up at Harvard. We have 4 ministers of health coming. We have a representative of Congress coming. We have Dikembe Mutombo, the basketball player, is coming. Dr. Julius Garvey, who is the son of Marcus Garvey, is a surgeon up in New York, good friend of mine, he's coming, and a host of other people who are working on healthcare in Africa. So it's actually coming together as a high-powered, you know, everybody's paying attention to it now. Everybody's paying attention to it. And so it's being live streamed across Africa. All kinds of delegates are coming from the continent, if Trump will let them into if Trump let them into the airport. They're going to try to come. A lot of the Africans are going to try to come. So we'll see how that one works out. But we got the World Bank, we got the State Department, we got USAID, but all the stakeholders are going to be part of the conference on cancer in Africa, cancer and other non-communicable diseases. So there's elements of mental health, there's elements of other diseases that don't get the normal coverage about health in Africa. And so we're excited about it. We'll see where it's going to go. Stella told me that she can't go because I think her niece is graduated from college, something. They're going to miss you. You'll be missed. Yeah. But, so I'm excited about it because we scaled it up. And in fact, Harvard is intimidated because you got all these big people coming now. Can you handle them? You know, my job was to get them to come, get them to agree to come. And I'm pretty persuasive in what I do. And so I got them to agree to come, but now can you handle them? You know, they're going to be coming at the airport. Are you going to be meeting them? You know, are they going to be satisfied with their time at the podium? You know, I don't know. You know, a lot of these people, they like a lot of time. You know, so they're scrambling up at Harvard, and I'm glad I got Harvard to get nervous. You know, that's doing something when you get an institution like that to get nervous. So I'm proud of myself. 3 weeks ago, I was in Ethiopia. Attending the launching, there's a planning session to launch the Africa Centers for Disease Control. This is something that we've been advocating for a long time. After Ebola, we said that, you know, we got to strengthen Africa's healthcare infrastructure in Africa to prevent the next Ebola or the next crisis. And, you know, they bought it, you know, they bought it. And so they structured Africa Center for Disease Control that's going to do surveillance, going to monitor, going to look at health challenges, and prevent, you know, at least be able to diagnose it before it happened so you could come up with a mitigation strategy. And so I was really the only outsider, if you will, to be invited. They chose about 150 people from around the continent, and these were the best and the brightest, those who are running laboratories and doing high research and from all over the continent. And so I represented you. I represented the diaspora. I represented very well, so you all should thank me for that. Yeah. I said, yeah, there's Africans. I said, you know, there's more Africans outside of Africa than in Africa. You know, when you think about those numbers, you think about Brazil and think about all the African people globally, you know, they say there's 1 billion on the continent. I would say there's 1 billion outside of the continent, you know. And then the 1 billion who are outside the continent, you know, we're lawyers and doctors, we run people like yourself, you know, we run stuff, you know. We're not just here consuming the air, we run stuff. We're opinion makers and decision makers. We influence the United States government. We influence Maryland. We influence all of the things that the people in this room represent, you know. And you multiply that across the country. There's 50,000 Nigerian doctors in North America. 50,000, there's 20,000 Ghanaians, you know, in North America, you know, Canada, United States. We over here saving white people when our people are dying in Africa. How do we mobilize our own people to have a better impact on Africa? And so I made that statement often, early and often during the summit. And so basically CFA is being asked to serve as the U.S. advisory committee for this Africa Center for Disease Control. John Ingerson, who is the head of it, is going to be on the phone next week for the Harvard conference. And then we're going to structure stuff over the next 2 years to ensure that, you know, our inputs are fully included. I think Africa needs the diaspora more than ever when it comes to this, you know. Africa needs the diaspora. Africa needs you, you know. Africa needs me, you know. And not that we want to run Africa, that's not our aim at all. But we want to improve the quality of life for our sisters and brothers on the continent, and we want to make sure that Africa is taken care of. So you're going to be hearing a lot more about this through Harriet and through Stella and others, but we're going to structure programs. I'm already thinking that we're going to have a number of workshops over the next year or two where we actually bring the Africa CDC to Washington and take them around the country to really get your inputs. And when I think about this task, I'm excited about it because I know for a fact we're running hospitals over here, we're running health systems. And we got all the skills and network that we really can apply in a meaningful way to help Africa. So I've been heavily involved on the health side. Last week I addressed a group called aortic, Harriet corrected me, because I was saying aorta, and she does the vein running down your neck, aortic. But these are cancer specialists in the United States and around the world who are actually from the diaspora, who are actually, looked at the same issue. Brilliant people. Look, everybody in the room got MD, PhD, and all kinds of other alphabets behind their name, except me. But they don't have any clue about the advocacy agenda. And so my job is, again, is to help them to figure out how to have impact on Congress, administration, Center for Disease Control, and other health entities in the United States. Let me say also, we're working closely with the Africa Union. The new chairperson here for the Washington, the new representative, we met with her a couple times. Stella joined us for one evening here, has been joining us, and already she's counting on us also to figure out a way to organize herself to be able to help Africa. And I think we're going to plan something in the fall here in Silver Spring for you guys to have a direct contact with her and direct access. So I'm excited about where we're moving with all this. I think we're on the right track. I think we're in the right train. We're moving in the right direction. Now, Donald Trump. I work with anybody. I work with the Republicans. Jack Kemp was my vice chair until he died, And my current chair, Dr. Roscoe Moore, people don't know that, he's Republican. He's one of them dyed-in-the-wool Republican, graduate from Tuskegee, former Assistant Surgeon General under Bush the father, and I think he stayed part of the time under Clinton. So I never had a problem with Republican, Democrat stuff, For me, it's all about Africa, and whether you're Republican or Democrat don't matter to me. Now, I'm a Democrat, but I can say that we work much more effectively with the Republicans. I mean, we couldn't do any better under than George Bush. George W. Bush. Now, he messed up everything else. He wrecked the economy, got us in 2 wars, horrible stuff. But in Africa, I give him a 10. A 10, only on Africa, right? So, for some reason, we tend to do well with somebody like Bush in the White House. We do have access. Now, with Trump is another thing. We don't know what we got. But our aim is to actually, we're working already. We had our conference last September with the aim of coming up with recommendations for the next administration. Not the Clinton administration or the Trump administration, the next administration. How smart are we, Everybody else is jumping on the bandwagon, right? And just assume that Hillary was going to win. I thought she was going to win. I wasn't shocked as anybody else. But Trump won, And if the conference would have focused on, Hillary, where would we be today? But we're neutral on this. We're neutral on the politics. We're just saying it's about Africa, and whoever's sitting in the White House, we got to find a way to work with you. I met with Omarosa early, in January at an event, and she's a different type of person. I concluded that she's probably the second most hated Black American today in this country. Clarence Thomas, number 1, Omarosa. So it's hard to figure out what the angle is with the Trump administration. But what I can say is that every president since Reagan has had a global health pandemic to deal with, be it bird flu, Zika, Ebola, AIDS, And the way pandemics work, you can't build a wall against a disease, You can't build a wall against a disease. And so Trump is going to have to deal with it one way or another. We've already made our overtures to him. We put some stuff in the press, and we're trying to link. I think within a year, if he's still around, we're going to have access to him. And I think the agenda is going to be healthcare in Africa. It's going to be an important aspect of his administration. I want to also say that on the cancer front, what we learned is that if you have cancer in Africa, if you have cancer in Africa, your chances of survival are 2, either slim or none. And if you're in rural Africa where most of the people live, you have no chance, And so if you come up with cancer, they're going to call it some other kind of thing. They're going to call it gastroenteritis, or they're going to call it something else, because they will not even have diagnosed what you died from. But all of a sudden you shriveled up and you had all these ailments and you're dead, Most of the country don't have radiation equipment. Most of them don't have training. They don't have any capacity whatsoever to mitigate on cancer, Now, I did raise it with the African CDC. These are the best and the brightest. They're on it. They recognize it. They want to do something about it. I think that you have a chance to advocate with this African CDC And I'm hoping that coming out of this report from this conference, I'm going to share it directly with the CDC, kind of let them know who they got here to help them. They're onto it. They want to do something, but they need help. You know, they need a lot of help. They really do. And see, on top of that, you know, the United States, our country, not only are we not helping, you know, there's unintended consequences. There's unintended consequences you got there. You know, we over here trying to do trade with Africa, so what do? We sell them Kentucky Fried Chicken franchises, and we sell them McDonald's franchises. And what you're seeing in Africa, obesity that you've never seen before. You're seeing cancers that we've never seen before. We're seeing a lot of things that, you know, that we never have seen before. So, you know, we got to not only advocate for the disease, we got to also advocate for good U.S. policy and good U.S. trade with Africa. They're calling my name, so I want to say thank you very much for, you know, hearing me out, for having me out here. This is a good way to start the morning. It's always good to have a chance to talk to your sisters and brothers about things that really matter. So thank you very much. Thank you. Good morning.